Alrighty.
Live from Vegas, it's primary care.
Daniel, thanks for joining me here at the health conference. Today we are talking about the digital.health platform. So just to kick us off, why don't you tell us exactly what it is, because you've been working on it. It's pretty cool platform. So what is it and what are you hoping to do with it?
So digital.health, that's the domain, easy to remember. Came to mind originally as I, for a while, have seen a lot of digital health, mobile health, connected health technologies. Obviously, there's thousands of apps. There's now a whole new generation of wearables. There's digital therapeutics. There's platforms to help clinicians and healthcare systems. There's a lot already out there, and as we're seeing here in Vegas and beyond, a lot of folks innovating and building new solutions. And so part of the challenge is just sorting out what's in the ecosystem. There's always like maybe a top 10 of apps for weight loss or for exercise, but I think in the digital health ecosphere, speaking as we're both clinicians, we want to be able to help. We want to be able to find and in some cases prescribe the digital health solutions that might match our patients' needs or those of our clinic or health system. And so digital.health is number one, is sort of a bit of a platform and a community, a resource for digital health. You can learn about what's happening in regulatory and in global health and podcasts, but at its core we have a database of now well over 1,700 companies and solutions, so that if you're searching for something related to diabetes or atrial fibrillation or mental health, you can find solutions that are already built, and within those listings, learn about them, learn about their evidence base, check out their websites, and save them in your own personal formulary, or start to prescribe them to your patients. So that's its early iteration of digital health, and we see it hopefully as an evolving platform and in collaboration with you and your team to be a real enabling tool across the healthcare ecosystem.
Right, so it sounds like for now we're starting with physicians, right? Bringing awareness to physicians of these digital tools and then helping them use it. How do you, or I guess, what is the best way that a physician can get on digital health and maximize the usage of the site?
Well, I think clinicians in general. It could be nurse practitioners, an issue there. Pharmacists, PTs, dietitians. I think the promise of digital health is to upskill all of us, right? Mm-hmm. And whether it's the data and the AI level, or the remote patient diagnostics, or just having better forms of communication, I think clinicians of all sorts are sometimes looking for solutions that are hopefully aligned with their workflow and their patient population. So the best way to use it today is just go to digital.health. Ideally, you can register so you can have a little bit of your own little listing and profile, and also have a place to save the solutions and technologies you're interested in. But I would suggest if you see any kind of clinical problem, it could be diabetes, it could be skin condition. You can pick any clinical nomenclature, and you'll find in many cases dozens or sometimes hundreds of solutions that are already there, and you can start to sort through them. Some are related to diagnostics, some are therapeutics, some are for operating your own clinical practice. And as we build out this database, there'll be more and more of them that hopefully you can cross-compare, rate if you'd like, so you can add your own opinion, and it can become essentially the ability to match the right solution for your need or those of your patients.
Now, speaking of patients, a lot of these digital health companies now are direct to consumer. Is there any room for patients or people who are interested in taking control of their own healthcare to go on digital health and find solutions for themselves?
Certainly, we're starting a bit with more of the clinical healthcare professional angle, but downstream we'll build more and more solution elements for the consumer. I'm looking for the best wearable for tracking sleep, not that there's a best one, or best apps that can help with stress and mental health challenges, or ones that might eventually require a prescription that I might need to go to my clinician and ask your doctor about the Achilles Health app that can help my kid with ADHD. But we're starting on the clinical side, but downstream we'll have, this is a platform that enables anybody to find and optimize the digital health solutions that will enable them to optimize health and wellness and prevention and health span, to pick up diseases early, and then therapies, which are still often largely siloed and with very intermittent data. And I think beyond just being able to sort of prescribe a solution, a connected blood pressure cuff, a smart pill bottle, a mental health app, I think the more short-term, but not quite here view is that you'll prescribe a solution, and the workflow will be such that the blood pressure numbers can come back to you when relevant. You don't want every single EKG or blood pressure, but Dr. Kenneth can see the 10 patients in his practice who are running 20 points above where they should be and need to have their beta blocker optimized. So a more distant view is that it'll not just be ability to find and prescribe, but for that information to flow in a way that fits into workflow and incentives and even payment models.
Right. And the people who are currently in fee-for-service who have very little motivation, I guess, to look into it. I know one of the points you talk about a lot in your talks is that doctors really should be into digital health, should understand it better. To the people who are kind of hesitant, they're like, I'm happy with how things are right now. What would you say to them to encourage them to care a little more about digital health and the solutions out there?
Well, hopefully we're all in healthcare for the right reasons. We don't want to just do sick care. We want to do true health care. And as incentives shift and clinicians and others get a better payment outcome if they keep their patients healthy, they will be incentivized to use some of these tools so the patient doesn't show up unnecessarily in the emergency room at 2 a.m. They might have atrial fibrillation. Why not send them home with an AliveCore device to track, 2 a.m. might help you when you're getting that call, not to send them to the emergency room and have to spend time managing it. So I think in many senses we're going to see these tools become aligned with the incentives of both clinicians. Of course, it depends on what practice pattern you're in. We'll be aligned with payment models because healthcare payers, whether it's Medicare or the Blues plan, will pay for that smart scale or app that helps manage your medications or the home robot or chatbot. And so I think it's a matter of opening your aperture and seeing that these tools in many cases are already here, and it's up to us to start utilizing them, even if they may not always be tied into our perfect payment model or workflow.
Now, on the flip side, there's a lot of companies, right, as you mentioned, and that's part of the reason the database exists, that are trying to get to physicians. And you mentioned there was a community there. Does the community involve both these companies interacting with the physicians? Is it just physicians, just companies? What does that look like?
So the digital.health community is relatively new, but it enables anybody from an individual clinician to a hospital administrator to a startup CEO or marketing person to be on there, and you could post a conversation. Now, what are the best tools you're seeing to help with clinician burnout? Or I'm looking for ideas for help doing regulatory on my new app. Basically, I think we want to build the cross connectivity to find other like-minded clinicians or folks who could help build that app for you, or to cross-fertilize the field. Because I think there's hundreds of thousands of health-related apps. Many more that are emerging are true digital therapeutics with FDA clearance software as a medical device. I think there will be some more consolidation. We're not going to need 1,000 diabetes solutions. We want the one ring to rule them all, or the one app that's going to more integrate our care continuum, both for the patient, caregiver, clinical team, et cetera. But so the community is a place to have those discussions, and anybody can pose a topic or a question. You can set up your own area around primary care, around pediatrics, around oncology, around any specialty or any topic. So anyone who comes on digital health who registers, which is free, give it a try. And if you have your own digital health company or solution, you can add it to the database. It's pretty easy to add a company and the solutions associated with it.
And one of the things that I think right now there's a big there are two silos, right, with digital health and practicing clinicians, and there's not a lot of crosstalk. And I think what's cool about this community is really the physicians can interact with the health tech companies can get back to the clinicians, and in a sense the physicians who get on early can actually drive some of these conversations. Do you see maybe doctors or other clinical providers really taking a front row or driver's seat role in these communities, and maybe even driving the digital health conversation through these forums?
100%, because essentially we see many examples of innovators building a solution and they build it and no one comes because you may not understand how the nurse, the physician, the payer, the pharma world interacts. And so I think we can use the digital.health community to be a bit of that sounding board. You might have a new startup or an idea and you want to find 20 primary care docs and say, what do you think about this in managing your patients with morbid obesity? Or I have a new idea and I want to collaborate to build it with others. So I think we'll see digital.health again, not just be a database, that's one of its components, but a community and a resource across the care innovation paradigm and the clinical paradigm, so that we can accelerate this sort of digital health age as we move forward.
So earlier you alluded to the primary care, which Paulius and I have been working on with you. The idea of a subdomain, right? With digital health, there's just so much going on that sometimes it can be overwhelming, especially you're really just focused on your specialty. So tell us, what was the original thought process in working with us for primary care.digital.health?
Well, first of all, it's great to meet forward-thinking, young, entrepreneurial, innovative clinicians in primary care and beyond, like yourself. And you are in the trenches every day. You see what some of the challenges and pain points are, but also have some great ideas about how to move these things forward. And of course, as you mentioned, digital health is a wide continuum, and you can imagine areas that are focused around a specialty, primary care, orthopedics, surgery, internal medicine. You picked your specialty, and so we're excited to work with you and Paulius on primary care.digital.health as sort of the first example of primary care is still pretty broad, but the ability to narrow that down to what's going to be useful for clinicians like yourselves in standard primary care, direct primary care, as well as your patients. And so that can be a little bit more of a narrow stack. So you can build, as we're building and launching, primary care.digital.health, where it'll be focused on the primary care clinician and the areas that and the solutions that you think are relevant. Similarly, we'll be doing ones for other specialties. So if you're interested in doing one around a clinical specialty, or you're an organization, Stanford.digital.health, or a pharma company, or a payer, or anybody who has an angle where you want to kind of consolidate the digital health innovations and solutions in your ecosphere. It could be the ones that you built, or the ones you're partnering with, or the ones that you think will be useful to your particular organization or society. We have the ability to build, custom.digital.health. And I think that will hopefully enable folks like yourselves to do a deeper dive, build out the content and the resources that are really useful for your particular community. And I think we can see that happen across the whole sphere of health specialties, fields, and innovation.
Yeah, and I think that'll be pretty fun to do, right? Tap into this mega database and really just select for our I wouldn't call it niche, but our specialties, right? More focus for what we need. And right now, digital.health, fairly new. When did it officially launch?
Just launched it late summer of 2022.
Yeah, so brand new. And I know you have a grand vision moving forward. You alluded to some things, but moving on into the next, let's say, 3 to 5 years, how do you envision it growing, and how do you see people using it?
Yeah, we all are familiar with the idea of personalized medicine, precision health. I like to think about the idea of also precision digital health and medicine, right? Whether you're prescribing a wearable, and the UI should be tuned to the patient's age, culture, incentives, personality type, right? It's starting to happen with some of the user interfaces. Similarly, when we have a patient with an infection and we look at the blood cultures, we'll see a matching list of the antibiotics that match. I think similarly we can think, here's a set of digital health tools and solutions that might match that individual patient or community. And because that list of available digital therapeutics and others are growing, digital.health will become the place to help personalize and give you recommendations. Think about, not just picking the right drug, but the right app and the right structure, the right sort of wearable operating system. Also understanding, the social determinants. Some folks will work better with certain types of phones or wearables or otherables, and others may be needing a very different touch point. So big picture, the next 3 years or so, I think we want to be to the point where you'll be able to pull in your patient's basic attributes and maybe their problem list. It might suggest, here it looks like the top 3 ways to help manage their blood pressure or their diabetes or their mental health challenges, and that makes it easy for you to prescribe them to them, as you could do today, because today on Digital Health you can make your own formulary. You can say, Kenneth, you're my patient. I could say, I'm going to prescribe you a live core and a connected blood pressure cuff, and this app for meditation, and here's something for smoking cessation. And those will be sent to you. You might download them or purchase them. The future hopefully will be one where it's tied into your payer. We're going to know the ones that are sort of on the formulary from your insurance company. You'll sort of hit the prescribe button, and they'll show up on the patient's doorstep if it's a device or some connected app, and that will automatically flow into your workflow, into the EMR that you happen to work with, whether it's Epic, Cerner, Allscripts, etc., in a useful way. Again, as clinicians, we don't want more data, we want the actual insights, and we hopefully don't want to have alarm fatigue. We want to, if we have a 2,000 patient panel, we want to see the 3 patients we need to call today because they're outside their normal set of biomarkers. So that's part of the longer range vision, and hopefully we're kind of creating a sort of a holistic, not just guide, but a way to utilize these technologies in ways that really impact outcomes, democratize care, and bring better outcomes at lower costs.
I think that's an awesome vision, and there's so much potential for this database that's built. So just to conclude, this is a question that we ask everybody, is so your background is PT Monk, and you're a futurist, a technologist, but we like to talk about primary care. So if what do you think is the future of primary care in the next, say, 5 to 10 years?
Well, I trained in both internal medicine, pediatrics, med-peds. Then I did
Okay.
HEMONC and bone marrow transplant. So I spent lots of time doing primary care.
All
And
right.
arguably, almost every specialist should be interfacing in some level of primary care, and we need to be a little more less siloed and help share the load. So I think that part of the future of primary care is that it's going to be much more continual care, right? I mean, we're all wearing different wearables. Does a patient show up in your office today? Can you download their Apple Watch data over a continuum and see that, wow, the resting heart rate went from 55 to 70 and something might be going on? Are you going to sort of get that kind of Minority Report check engine light that Mrs. Jones looks like her digital biomarkers, her voice print, her scale data suggests, wow, she's going into heart failure or has some early sign of Parkinson's? So I think primary care can start to become much more proactive care, much more integrated with the patient as a partner in the care, meaning they're going to be engaged at the level that matches their kind of human needs and personality and station in life, so that we're doing primary care together, and that it's going to be much more not just data driven but insight driven, and more excitingly, hopefully, as we enter this era of multi-omics and every patient gets sequenced. It's $200 today. In 5 years, it'll be $50. It'll be less than a CBC or a chest X-ray. You're not just going to have someone's base genome and have their, hopefully their pharmacogenetics, but you'll have the metabolomics from their CGM patch that they may have done for a week or two. You'll have their microbiome data. You'll have their physiome. You'll start to have the stack and the idea of a digital twin, which will be leveraged so that we're not doing evidence-based medicine based on some 10-year-old double-blind placebo-controlled trial in patients that are not really normal because they have no comorbidities. It's going to be one that's continually crowdsourced a bit. I always kind of give the example of the Google Maps or Waze of healthcare. We're going to sort of see the data, the insights from millions of patients, or patients like mine. There's a company I advise out of Israel called StuffThatWorks.health, which is an early example of patients being able to share what's working and what's not working. It gives them insights, but it should start to give their clinicians insights as well. So I'm about to start biologic on a patient with IBD. I might want to pick one that's really going to work for a subset of patients, just like the one sitting in front of me. So I'm riffing a bit, but I think the future of primary care will hopefully be much more, not just data-driven, but insight-driven, much more continuous and proactive, and will be more on the healthcare side. This idea of new markets for precision wellness, helping people live long, healthy, optimized health span lives, not just waiting for them to show up with the problem, will be part of this new role of primary care.
Yeah, I love that vision, and listening to you talk, all your content, your TED Talks and your podcasts, it's always really cool, that future that you paint. So
well,
yeah.
There's that old adage, William Goodson quote, the future's already here, it's just not evenly distributed. I mean, you guys are leveraging that in direct primary care, on X primary care. You're going to help build that on primary care.digital.health. It's not about always waiting for some future to arrive. It's like, how do we take all the amazing tech stacks we have and make them work? And sometimes that's not about the technology, it's about culture and mindset and the art of the possible. And there's a famous quote from John Maynard Keynes, the challenge isn't the new ideas, it's escaping from the old ideas. And a lot of our friends and colleagues and department chairs and deans of medical schools and residencies are still stuck. And this is the way we've done it for 30 years. And they're not realizing that we're now, in this age of superconnectivity, Web3, metaverse, Internet of Medical Things, personal genomics, that if we were smart about integrating them, aren't the future, but they're here now, and we could really integrate them into care to make it much more health care, not more sick care.
Absolutely, I love that. Well, Daniel, thanks so much for joining me, and thanks for kind of sharing your thoughts. I really appreciate you joining.
Well, thanks for your involvement, and for any of you guys listening out there, check out digital.health. We love your ideas, your involvement, your participation. It's a work in progress. Also, join my community at nextmed.health. That's where we're bringing folks from all sorts of clinical fields and specialties, not just in digital, to sort of rethink and reimagine healthcare. The future of health and medicine isn't any one silo or technology or digital or otherable. It's sort of how we kind of see what's here, what's coming next, and connect the dots so that we're doing things in smarter ways that help everybody.
Great.
Hi, I'm Dr. Daniel Kraft. I'm a physician, scientist, innovator with a few hats. I'm the founder of digital.health, also the founder of nextmed.health, or NextMed Health, which is a healthcare innovation platform and event that grew out of the exponential medicine program that I've run for 10 years. I'm also the co-founder of Continuum Health Ventures. We fund seed stage digital health companies. And I also help advise the X Prize on all things healthcare related. So it's fun and also challenging to juggle all these elements. Still licensed as a clinician, and hopefully help catalyze the future of health and medicine.
And I'm Dr. Kenneth Qiu with X equals Primary Care.
Short and sweet.
Awesome.
Right,
Awesome.
that's
I
pretty
appreciate
good. That's awesome.
How was it? Was it fun?
Yeah, that was great. I
Hey,
didn't know
that
we were-
was amazing.
I didn't know we were going to do what we're doing today.
You are totally
Just
talented.
riffing.
Yeah,
Yeah, it's fun to riff, and that's the way things are best done.
Absolutely.